Today, I'm going to share with you the No. 1 supplement that will make your penis stronger. I'm a urologist and pelvic surgeon, and I'm going to talk about the No. 1 supplement that can help you get rock-hard erections. If you like what you see, make sure you subscribe so you don't miss any new videos I post. And if you have a question for me, please comment below. I'll try to answer as many questions as I can. So let's talk about supplements for the penis. So there are a lot of supplements out there that promise to increase your penile girth or increase your length, and unfortunately, most of them don't really work. In fact, the only way we know of right now to increase the length of your penis is through surgery, and I've talked about that in my prior videos. There are ways that we may be able to increase girth, but at the end of the day, they're all a little bit iffy and probably not worth the money. However, there's data behind a supplement that can help with stronger, harder erections. And that is because the No. 1 cause of having difficulty getting erections is having low testosterone. And I've made an entire video about low T or low testosterone, so make sure you watch that after this video. So when we think about low testosterone, it's important to know that it affects men of all ages. It doesn't just affect older men. In fact, 20% of men between the ages of 20 and 39 have low testosterone, right? And 50% of men over the age of 40 have low testosterone. And unfortunately, low testosterone gets worse with time. So men who are 70 years old, 80% of them have low testosterone. Now, why does testosterone decrease over time? Well, it's because the testicles actually make testosterone. And what happens is, as men get older, the testicles shrink, and therefore less testosterone is produced. The next question is, how do you know if you have low T? Well, you can have a blood test done. And what's important to know is that normal testosterone levels are between 300 and 900 nanograms per deciliter. And anything less than that can be considered low testosterone. However, sometimes people have low testosterone symptoms, and their testosterone is right at the line. So we want to operate on someone whose testosterone is 299 when it's really not bothering them. So I always tell my patients, if you're bothered by your symptoms, you don't need to get surgery. We can treat you medically as well. Some of the symptoms of low testosterone include decreased libido, difficulty in the morning getting an erection, difficulty getting an erection during the day, and even sometimes increased breast tenderness. Now, if you've watched my video on low T, you'll know that there are multiple different medical treatments for low T, including testosterone shots, testosterone gels, and pills. But how does this relate to having better, stronger erections? Well, in one study, they took 96 men who had erectile dysfunction. Half of them had low testosterone, and half of them did not. And they gave the men who had low testosterone replacement therapy, and they found that at 12 weeks, 69% of the men had improved their erectile function. So this is a very simple way to potentially change your erections by getting on testosterone. In another study, they looked at men with organic erectile dysfunction, meaning they had either low testosterone or some other medical problem like heart disease or diabetes, which was causing the erectile dysfunction. They randomized these men to either receive testosterone or a placebo, meaning a sugar pill. And what they found was that at 12 weeks, 51% of the men in the testosterone group had improved erections compared to 18% of the men in the placebo group. So, testosterone replacement therapy can significantly improve erections. There's also another class of medications called PDE5 inhibitors, which are the most common medications used to treat erectile dysfunction. These are medications like sildenafil, tadalafil, vardenafil, and they all work to relax the muscles in the penis, allowing more blood flow into the penis to cause an erection. But these medications are only effective in men who have a certain amount of testosterone. So, if your testosterone is very low, these medications won't work. And in those cases, you should talk to your doctor about starting testosterone replacement therapy. And it's important to note that testosterone replacement therapy is not right for everybody. You have to undergo a thorough evaluation to make sure you don't have any underlying conditions where testosterone might be falsely low. And that is exactly why we do these thorough histories and physicals, to make sure that you read truly a good candidate. So the most common form of testosterone replacement therapy is either injections into the muscle or gels that you apply daily to your skin. The testosterone that we use is called testosterone cypionate, M, and this is a form of testosterone that lasts a long time in the body, so you only need to get it every 2 to 3 weeks if given as an injection. If you're using the gel, you apply it once a day, and it lasts for a day. The most common side effects of testosterone are due to having too much testosterone, and that can include acne, mood changes, irritability, decreased amount of semen, and sometimes even hair loss. So we try to avoid giving people large amounts of testosterone. We only give people the amount that's equal to the amount that they used to have, usually between 500 to 700 nanograms per deciliter. If you're interested in learning more about supplements, specifically for the purpose of increasing your penile girth or length, comment below. Let me know if you'd be interested in a video about the top supplements that promise to increase your penile girth or length. The next question is, how do you prevent rectal dysfunction? Because it's not just low testosterone that causes erectile dysfunction. Other risk factors include being overweight, having high blood pressure, or diabetes. So if you're concerned about preventing erectile dysfunction, focus on eating healthy and exercising regularly to keep your weight down and manage any chronic medical conditions like diabetes or hypertension. Also, if you're interested in learning more about premature ejaculation and how to last longer in bed, I've got a great video about that I highly recommend you check out. Also, make sure you subscribe so you don't miss any new videos. Okay, if you have a question for me, please comment below. We'll try to answer as many questions as I can. As always, remember to take care of yourself because you're worth it.